Tim White Sands teammates, good day. We continue to adjust our posture to protect our people, you and yours. These adjustments are based on local conditions, increased understanding of COVID-19 risks and proven practices, and state, CDC, Army, DoD, and federal guidance. Accordingly, the following measures are in effect immediately. 1. You are the first line of defense. Take everyday actions to stop the spread of germs. Avoid close contact with people who are sick. Wash your hands often and for at least 20 seconds with soap and water. Cover your cough or sneeze with a tissue, then throw it in the trash. Cough or sneeze into your elbow if tissues are unavailable. Avoid touching your eyes, nose, and mouth. Ensure all immunizations are up to date, including your seasonal flu shot. Stay home if you are sick and avoid close contact with family members and pets. Create an emergency preparedness kit to sustain you and your family for 14 days. Routinely clean and disinfect frequently touched objects and surfaces. If you are sick, call your medical provider for instructions on receiving care before going to the clinic, and if feasible, notify your supervisor. If you're already at WSMR and become ill, call MCAFEE U.S. Army Health Clinic at 575-674-3500. 2. Practice social distancing, personally and at an organizational level. Reduce all in-person meetings to 10 personnel or less. Mitigate larger meetings by utilizing video teleconference or dial-in. Minimize visits to facilities by outside personnel and conduct meetings with visitors by utilizing video teleconference or dial-in to the maximum extent practicable. Maximize the use of alternate locations and vacant space in order to increase personal separation of staff. Prepare to enable the implementation of maximum use of telework for telework-ready personnel. 3. Limit travel to include OCONUS travel. Effective March 13, 2020, all DoD uniformed personnel, civilian personnel, and family members traveling to, from, or through Centers for Disease Control and Prevention, CDC, Travel Health Notice Level 3 COVID-19 designated locations, currently China, Europe, Iran, and South Korea, will stop movement for the next 60 days. Additionally, concurrent official travel for family members of DoD uniformed personnel and civilian personnel is denied to CDC Travel Health Notices Level 2 COVID-19 designated locations. Military leave and travel for military members is limited to the local area. Cease all temporary duty travel and attendance at conferences and unit social gatherings by personnel through May 11, 2020. Requests for exceptions will be routed through the Commander, WSMR. Personal travel. Minimize your potential exposure. If you have planned travel, you should cancel or reschedule. Understand that if you travel, you will be asked the same questions. We will use to pre-screen potential visitors, and access to the installation may be limited or denied. 4. Pre-screen potential visitors. Ask 2 questions of any potential visitor, official or unofficial. 1. Within the last 14 days, have you been to or transited through a Level 2 or Level 3 designated location? 2. Within the last 14 days, do you believe that you have been exposed to COVID-19 or that you have COVID-19? If your potential visitor answers yes to either of these questions, they should be in quarantine, and ask them to either contact the public health department or their local medical facility. Use common sense and be careful. During this time of heightened awareness and protection against potential health risks associated with COVID-19, there is also an increased risk in scam methods used by cyber criminals. The U.S. Army Criminal Investigation Command has said that some phishing campaigns prey on would-be victims' fear while others capitalize on the opportunity created by hot topics in the news cycle. The COVID-19 pandemic presents cyber criminals with a way to combine both into a dangerous 1-2 punch. No, there are multiple efforts underway to enhance the protection of the community. These include the cancellation of major events associated with the Bataan Memorial Death March and the April 4 Trinity Open House. They also include increases to the frequency and cleaning of the commissary, troop store, roadrunner lanes, and spare time lounge, what we like to call the bowling alley, and the Frontier Club. Keep calm and communicate. We are establishing an All Things COVID-19 button on the WSMR web pages, both internal and public facing. The button will be amber and will take you to a separate page that will have the latest information from WSMR and links to the most current information from the CDC, the Army Public Health Center, the Department of Defense, and the Army. It will have a COVID-19 reference guide that provides references, background, potential impact, and guidance. Additionally, we are holding virtual town halls to provide further updates and answer your questions. Let me close with the importance of taking care of yourself, your families, and the people around you. We are the first line of defense for ourselves by maintaining good hand-washing habits and practicing other daily health routines to minimize the spread of germs. If you are sick, please coordinate with your supervisor to take sick leave or make alternative work arrangements in order to protect others. You and your families are critical to the WSMR mission, and we are fortunate to have such a dedicated team and workforce. Maintaining your trust and good health is among our highest duties. We have a tough road ahead of us, but we will prevail. Thank you for your service. It is an honor to serve alongside you. What are your questions? Send them to this email address, and I will address them in our virtual town hall to be broadcast on Facebook today at 6 p.m.